Hi everyone, this is Steph Stapleton of Boston University, Boston Medical Center. I'm sorry I can't be with you in person, but my wife has COVID, and although she's feeling a little bit better and I'm doing fine, I did not want to bring all of that to you. So today I'm going to briefly talk about my wearable abscess model. Why develop a wearable abscess model? There's plenty of different models out there. Well, the big reason is I think having it on a person and having to position yourself and deal with the patient while you're doing a procedure is a huge part of success in doing any procedure. Additionally, I wanted something that was really quick to assemble and reassemble and that was shelf stable. So no meat products or animal products or anything else that had to go in the fridge. So what do we need to make this happen? Well, as usual, almost everything is available on Amazon. However, most of this is actually available at your Target or whatever large supermarket you want to go to, with the exception of a few things. So what do we actually have here? Cling wrap, of course, you can get virtually anywhere. This element here is something called a tattoo practice pad. This is basically silicone skin that will that you can end up strapping around to your arm or wherever you want to. This is actually what started out as a Kevlar arm protectant and has been upgraded to a pleather arm protectant. We'll talk more about that later. Balloon, just regular party size balloons, and then a cosmetic sponge. So before you even start assembling everything, you just want to make some pus and actually put it in the balloon. For me, again, I wanted something shelf stable. So although chicken soup and all sorts of things make good pus agents, not to mention tapioca, I wanted to do something I didn't have to think about. In fact, I left some of these really as an experiment for over a year to see how they fared, and they were fine. So for my pus, I used unscented lotion because I didn't want it to smell good. I used a little bit of Yale food coloring, a little bit of water just to make sure it wasn't too thick. And then I put it in a non-luer lock syringe and then put it in the balloon and then self-tied the balloon. For the cosmetic sponge, all you're going to want to do is you almost cut it in, fold it in half, and then cut a little bit out of the center so you make a little divot for your abscess to rest. All right, so let's assemble. So first layer, you're going to put on the arm gauntlet. Again, here is Kevlar. I started with Kevlar thinking it was great and impenetrable. However, it's actually a knit material and as such has little holes. So could allow for needle and small blades, like 11 blades, to actually go through. No one got hurt in my first round, but I'd like to not have that happen. So I swapped using pleather arm gauntlets. Next is cling wrap, and that's really just to keep the mess off the person. Next, you're going to put your abscess that you've made into your hollowed sponge right here, and then flip the whole thing upside down. Next, you're going to actually put the practice skin on and then strap it in place tight enough that it's not going to move around. Someone can help you with this, but you can also do it yourself if you like. And last but not least, go have fun. Get all the pus out. It's a great time. Everyone laughed. You can make it as explosive or non-explosive as you'd like. Feel free to email me at snstaple@bu for any questions. Thank you.
So just in case you guys didn't hear that, she used lotion and dyed it yellow so that it was shelf stable rather than, but I always liked cream of chicken because I think it also has a smell element to it. Because I often find that helps, but maybe not so much anymore with masks.
Yeah, we use mayonnaise a lot too, and that's
Yeah.
equally disgusting.
Yeah.
She brought up a good point, which is these Kevlar things that you can wear are often very something that you would try for a wearable model. But the Kevlar that we use, I guess it'll stop a bullet, but it's not great with a scalpel. So we've switched over for most of our wearable models to Kydex. I don't know if any of you have ever worked with that before, but it's a plastic impermeable material that with heat you can actually mold into whatever shape you want. So our wearable Crike model and our wearable like I&D model, we've replaced it with that material, and that is pretty much impenetrable, even with a scalpel and a strong hand, or 16 gauge needle.
We'll still ortho glass every once in a while that it's expired.
Oh, very nice.
That kind of, so put that as an extra layer underneath there that you can mold to a regular person's arm and kind of reuse then over and over again as another kind of block, but
Nice.
just expired things. You want to do it from there?
Yeah, that's weird. Yeah, thanks.